Hello, welcome to National Council of Jewish Women's Abortion Access Week of Action Lobby Day webinar. My name is Faith Williams, my pronouns are she, her, and I'm the Associate Director of Government Relations and Advocacy at NCJW. This webinar will cover all the information you need to have a successful lobby visit on the Stop Anti-Abortion Discrimination Act during the Week of Action, which is September 12th through the 16th, or really to have a successful lobby visit on that bill anytime this fall. Today, we'll start by hearing from Aviva Zadoff, Director of Advocacy and Volunteer Engagement at National Council of Jewish Women, New York, who will talk about what crisis pregnancy centers are, why they're a big issue, and what the section is doing to combat crisis pregnancy centers. Next, NCJW Manager of Government Relations and Advocacy, Simriti Krishnan, will talk about the bill. Then, I'll give an overview of how to execute a successful lobby visit and talk about your next steps. Information about the bill, about holding a virtual lobby visit, including this webinar, can be found in the Week of Action Planning Guide, and I've linked to it on this slide. You'll see this link on a number of slides. If you're watching a recording, you can hit pause and write it down and put it into your browser and find the toolkit. And again, all the information that we're going to talk about today can be found in that guide. With that, I am pleased to turn the webinar over to Aviva.
Hi, everyone. My name is Aviva Zadoff. As Faith mentioned, I am the Director of Advocacy and Volunteer Engagement at the National Council of Jewish Women, New York. And I'm also the lead staff person on our Pro-Truth campaign in New York, which is all about crisis pregnancy centers, educating people around what they do, as well as advocating for oversight of crisis pregnancy centers. So let's talk a little bit about what crisis pregnancy centers are. Crisis pregnancy centers, we also sometimes call them fake clinics, and in a lot of legal language, you'll see them referred to as limited service pregnancy centers. They're clinics that are set up by anti-abortion advocates and often religious activists. These clinics are set up with the purpose of preventing pregnant people from accessing abortions. And I'm going to talk a little bit about how they do that a little later. The fake clinics don't really generally counsel people about all their options, and they could be misleading and use a number of tactics to do so. So for people who are trying to access an abortion or general reproductive health care, finding yourself at a crisis pregnancy center can really do harm to a person in being able to access the healthcare that they are looking for. You could go to the next slide. So a little bit of information about crisis pregnancy centers. We like to refer to them as the service arm of the anti-choice movement. So a lot of time and energy is rightfully spent on the legal side of the anti-choice movement and the laws that they are passing that are actively working to keep people from being able to access abortion. Crisis pregnancy centers are the on-the-ground movements of, people in communities who are activists and trying to keep people from accessing abortion. And that is their goal, is to stop people from obtaining an abortion. A lot of people don't know about crisis pregnancy centers, and that is part of how they operate, in that they are a little bit secretive and they are able to operate a little bit in the shadows. But the truth is that crisis pregnancy centers are not a new phenomenon. They are something that have existed since the 1970s. Actually, if you sort of track the history of crisis pregnancy centers with the history of abortion becoming legal in this country, there's almost a parallel track that as abortion became more accessible in this country, more and more crisis pregnancy centers popped up and the organization around them and the funding around them became much larger. There are some crisis pregnancy centers that will offer limited medical services. And the trend is that they are starting to offer more and more services, and that has to do with trying to become more legitimate looking. It has to do with funding and different funding streams that they're able to apply for the more services that they offer. We've also seen a recent trend of these crisis pregnancy centers that are offering STI testing for sexually transmitted infections, which is concerning to look at and note, because if they are providing STI testing, what kind of STI counseling and information are they giving, and what treatment are they providing, given their general stance on medicine and activism through medicine. And they also sometimes provide school-based sexuality education, which again is very sex negative, does not talk about the full spectrum of sexuality and the human body. So it's, coming from a very religious perspective, and oftentimes can be very shaming and negative to people who experience sex education through the crisis pregnancy center. One of the things that crisis pregnancy centers often offer is something called material support. So when someone comes in, if they are questioning whether they should continue a pregnancy and parent, or if they should have an abortion, they will try to persuade a person to keep their pregnancy and to parent by telling them that they will support them with items needed to raise a child. Now, first of all, the items that they actually do support them with are limited, right? A package of diapers is only going to go so far. They're not giving you a lifetime worth of diapers. But they also often tie this material support that they're giving to religious-based classes that they or a local church provides. So they will set up a system where you go to classes and you earn, through going through these classes, what they call baby bucks. And the more baby bucks you have, the more items you can purchase from the crisis pregnancy center. So it's very much tied into trying to indoctrinate people and to push a specific agenda on people. And the other thing that we often see with crisis pregnancy centers is that they try to create an image where they are just these nice people who see a problem in their community and want to help out, and they're just trying to do some good. Well, the reality is that crisis pregnancy centers are well-funded and well-connected to the anti-choice movement. There are larger organizations called Birthright and other organizations that will basically give you money and tell you how to set up a crisis pregnancy center. And they're all really connected to these larger movements that are also doing these, abortion access bills in our state legislators. So there's this really deep connection and a very large funding stream available to crisis pregnancy centers. Next slide. So I want to talk to you about how crisis pregnancy centers operate. So again, their mission is to stop people from accessing abortion care. So their whole mode of operation is at any stage that they encounter a person, it's just about getting them into their crisis pregnancy center so that they can, talk to them and push their anti-abortion agenda. So whether it's on a phone call, whether it's they're doing, sort of street, advocacy outside of a clinic, their whole goal is to get people to come in. So some of the things that they do are to have misleading language and signage. Oftentimes they will call themselves, their names will have the word choice in them, or women's health, pregnancy, options, those kinds of buzzwords that would make it very ambiguous or unclear about what they do. They design their offices to look like a medical office. So oftentimes you go in, there'll be a waiting room. People will be wearing scrubs or white lab coats and have a stethoscope when they might not be medical professionals. They will have volunteers wear that even if they're not in the medical field. They also do something called co-location, which is to specifically set up next to, across the street from an actual clinic to make it as confusing as possible. So they will try to be as close to a real clinic as possible. And then sometimes in addition to that, they will have people on the street in front of the real clinic to try to talk to people and usher them into the CPC instead of the real clinic. Here in New York, we have one of our largest in the city, one of our largest abortion providers, Planned Parenthood in Brooklyn, has a CPC in the same building. So it's literally 2 floors above the Brooklyn Planned Parenthood. You push the wrong button in the elevator and you get off in the wrong place. Again, just the idea of getting people in so that they can talk to you and give you their pitch. Something that we've had a lot of problems with is their search results and the advertising that they use to buy ad space on Google and Yahoo and some of the biggest search engines, so that when somebody types in abortion services, a CPC will go to the top of that list. It'll be the first thing that a person sees. And again, with their misleading language and their websites that look very similar to a real clinic, it adds this layer of confusion. And they really thrive on creating uncertainty and confusion so that people don't see what their larger agenda is. Thankfully, just very recently, Google has started to take some steps to identify when you search for abortion clinics that actually perform abortions and clinics that don't. And we hope that that trend will continue. Once a person is inside of a CPC and talking to somebody who works or volunteers at the CPC, their whole goal is to keep you from getting an abortion. So they will use medically inaccurate information. They will tell a person, did you know abortion causes cancer? It causes infertility. It causes depression. None of those are true, but they will do that to scare a person when you are, sitting with somebody who, like I said, is wearing scrubs, who looks like a doctor. There's a level of trust there. And they really manipulate that to their advantage. They will use intimidation tactics that we have heard of, scaring people about what an abortion procedure is actually like. They will use very gruesome imagery. They will really try to make an abortion seem like a scary process. They will use delay tactics. So, they will tell you that, oh, you're only a few weeks into your pregnancy. You have a ton of time to decide, even though obviously, as we know, with the laws being passed in this country, timing is very important in terms of being able to make a decision. So if you're delayed, that could be the difference between being able to access an abortion in your state, having to go out of state, being able to receive a medical abortion rather than a surgical abortion. So timing is very important, and they try to use that to their advantage. They will follow up with people in a very harassing way. So calling people over and over and over again to say, what did you decide? Are you going through with the pregnancy? And we've also seen examples of them following up with people's emergency contacts. So, you're going into a place you think is a medical clinic. You're filling out a form the same way you would when you go to a doctor. But if it's not a licensed medical facility, they are not bound by the laws of HIPAA, which protect our privacy as patients. And so we have heard stories of them calling a person's partner, calling a person's parent and saying, did you know that this person came into our facility looking for an abortion? And given a person's home situation, that could put someone in a dangerous situation. And one of the things we've seen is that they target vulnerable groups. So they will specifically set up in communities with a lot of non-native English speakers, low-income communities, college communities, places where there might be distrust about the medical community, where free services might be really appealing, but also where a language barrier might be used to help them. Next slide, please. So this slide is a map from the Crisis Pregnancy Center map, which can be found linked at our Pro-Truth website, which is at protruthy.org. And I wanted to just show you that CPCs are everywhere. A lot of people, if they know that they exist, they think that they're only in, the Midwest or the South. But the truth is that they are everywhere, and they outnumber real clinics by a large majority in this country. So the likelihood is whatever state you live in, whatever neighborhood you live in, there is probably a crisis pregnancy center near you. And that is one of the reasons why in New York, for our Pro-Truth campaign, we have mapped out every crisis pregnancy center in the state, as well as every real abortion clinic, so that people can know where they're getting their services and decide where they want to get their services. Next slide. So CPCs in this post-Dobbs world, we're expecting that as, abortion becomes less accessible in certain places, we're going to see CPCs step up more and more. So we expect in abortion hostile states that CPCs are going to try to step in to the role that clinics have played as, clinics are having to close or move. We're going to see more and more CPCs there ready to step in to provide services. In the abortion-friendly states, we also expect that we're going to see a large growth of crisis pregnancy centers, because now that they have fewer places where abortion is going to be accessible, and I realize I have a typo on this slide, so sorry about that, they're going to really hone in on those places where they know people are going to be going to get abortions, but also that people are going to be traveling to these places. So, when you're traveling to get an abortion, again, it's a lot more stressful. It's a lot more confusing. Timing is a bigger issue, and they're going to flood these areas with crisis pregnancy centers to add barriers and add to the confusion of trying to access an abortion. So what can we do? As I've mentioned a couple of times, we have our Pro-Truth campaign. We have it here in New York. We also, about a year ago, launched a campaign in Florida with the NCJW Miami section. And Pro-Truth is all about educating ourselves and others about crisis pregnancy centers, because the more people that are aware of them and see what they do and see what these maps actually look like of these thousands of crisis pregnancy centers, that helps take the power away from these places and gives it to people to be able to make a decision about where they want to get their health care. We also work to do advocacy work for more regulation and oversight of these places, because we don't believe that anyone should be lied to about their body and about their healthcare options. If a crisis pregnancy center, if a religious group wants to set up a clinic that has a specific agenda, they have a right to do that, but they shouldn't be able to lie and to deceive people about what they're doing. They should be open and honest and allow people to choose where to get their care. And so we think there should be standards and regulation about how these places could operate. So thank you so much for having me, and good luck on your lobby visits.
Thank you so much, Aviva. Next, we'll turn it over to Smriti.
Hello, everyone. Welcome to my part of this webinar. My name is Smriti Krishnan. As you heard Faith say, she, hers. I am NCJW's Manager of Government Relations and Advocacy, and I'm so glad to have this opportunity to speak with you about working on the critical issue of abortion access at this very historic moment. Next slide, please. Today, I will be sharing a brief overview of the Stop Anti-Abortion Disinformation or SAD Act, HR 8210 and S 4469. On the House side, the SAD Act was introduced by Representatives Maloney, Bonamici, and their colleagues. And on the Senate side, you'll see that the SAD Act was introduced by Senators Menendez, Warren, and their colleagues. As the title of the bill suggests, the SAD Act aims to curb the spread of misinformation about abortion. Next slide, please. To keep my thoughts on track, as I discuss the bill today, I'll be touching on two aspects of the bill, the findings section and the substance of the bill. I'd like to share a little bit more about why the findings section of this bill is so important. The findings section of the bill explains the reasoning for why a bill is important, why it's needed, why Congress needs to act on this issue. And so here, the findings section reflects feedback from the reproductive justice community. And so I'd like to discuss this section in a bit more detail. You heard from Aviva earlier on the dangers that CPCs represent. And so the findings section of the SAD Act underscores this danger. The section cites two statistics from the Journal of Medical Internet Research, Public Health and Surveillance. These statistics emphasize the fact that nationwide, CPCs outnumber abortion clinics by an average of 3 to 1. Many CPCs don't employ licensed medical personnel or provide referrals for birth control or abortion care, even though they advertise themselves as providers of comprehensive health care. CPCs intentionally mislead patients about their options during pregnancy and delay time-sensitive care, obstructing patients' right to honest and accurate medical treatment and information. Next, I'd like to talk about the substance of the bill. The SAD Act directs the Federal Trade Commission to prohibit deceptive or misleading advertising related to the provision of abortion services and authorizes the FTC to collect penalties from entities in violation of this prohibition. Advocating for the SAD Act is consistent with the Jewish value of pursuing tzedek, justice for all, because patients should receive truthful and accurate information about all of their healthcare options, including abortion care. Now, I just mentioned the penalties that the Act imposes, and so I'd like to talk a little bit more about what those penalties would be if there were violations. The civil penalties that could be imposed would be of up to $100,000 or 50% of the revenues earned by the ultimate parent entity of a person during the preceding 12-month period. The FTC may also bring a civil action in any appropriate U.S. district court if it believes that a person has violated the prohibition. Now that an overview of the SAD Act has been provided, I'd like to share with you what the ask would be of the members or their staff that you potentially meet with on the House or Senate sides. Next slide, please. As you work on scheduling visits with offices on the Hill about the SAD Act, the ask would depend on whether the office has already co-sponsored the SAD Act. You can go to congress.gov to check to see if the member you're meeting with is already a co-sponsor of the bill. Congress.gov also has all the information about the SAD Act, both the House version and the Senate version. If a member has not yet co-sponsored the Act, the ask would be for that member to consider becoming a co-sponsor of the Act. If a member has already co-sponsored the Act, the ask would be for the member to talk to colleagues who are not yet co-sponsor about the importance of the SAD Act in the hopes that those colleagues would hopefully co-sponsor the SAD Act. Furthermore, you could also ask the member to speak out in support of the SAD Act on social media or through floor remarks. Obtaining more support for the SAD Act is crucial at this time because this act speaks to an important abortion-adjacent issue. That issue is misinformation. The SAD Act acknowledges the harmful influence that the network of CPCs has on our country by spreading dangerous and deeply biased information. We're at a historic moment, a time where the constitutional right to abortion no longer exists. And this is the first time in my life that this constitutional right to abortion no longer exists. And many of you may share my experience. So this is why allowing misinformation to be spread about abortion now, when so many are particularly concerned for their healthcare and lives, is dangerous. Legislators should respond to the relentless spread of medical misinformation by helping to pass the SAD Act. So thank you so very much for your time today and your forthcoming advocacy on the SAD Act. And now I will turn it back over to Faith.
Thank you, Smriti. And thank you, Aviva, as well. So again, my name is Faith Williams. My pronouns are she and her, and I'm the Associate Director of Government Relations and Advocacy at NCJW. This portion of the webinar is about how to plan and hold a successful virtual lobby visit. The only difference, honestly, between an in-person visit and a virtual lobby visit is technology. Everything else you're about to hear is pretty much the same. So if you've been lobbying in person prior to the pandemic, you're in good stead. If you've lobbied during the pandemic virtually, you're in good stead. You can take all of the tools and tips you already employ into the week of action coming up. So the first step is to coordinate with people in your section or state. In states with SPAs or state policy advocates, NCJW has asked SPAs to set up meetings with senators' offices. In states without SPAs, it's worth reaching out to your section leadership. If you are not a member of a section, we encourage you in an area in particular, in an area without an NCJW section, you are welcome to set up these visits on your own. How do you do that? So you use a combination of phone calls and email to set up your meeting. In the week of action guide, which is linked throughout, including on this slide, is a sample meeting request email, which you can also use as a script if you call the office. The goal is to find the right staffer to meet with who covers the issue. In this case, you'd be asking to meet with the staff person or people who cover women's health or abortion. Different offices kind of term it different things. You are also welcome to make a request to meet with a lawmaker themselves. Sometimes that happens and sometimes you meet with a staff person, and both are great ways to make an impact. You may need to follow up a few times to get a meeting scheduled. It is easier in some offices than in others. And once you have something on the books, you want to work with the staffer to decide on what technology you want to use. Some offices have specific rules about what they are allowed to use and others don't. There are a number of free conference call tools and free Zooms that you can use for your visit. A great meeting can happen regardless of technology. It's just another step you need to take. Once you've settled on a technology, make sure all participants for your meeting have the link or access to the technology you're using, including the staff person that you're meeting with or people that you're meeting with. Last, tell NCJW Inc. when you've scheduled a visit, and we have the link to do so in the Week of Action Planning Guide, which I've linked to here. Once your visit is scheduled, it is time to prepare. The first step is to connect with others attending the visit. In particular, if you are a member of a section and you're going on a section visit, you want to connect with each other to do all of these next steps. So first off, you really want to learn about the issue. Read NCJW's talking points on the SAD Act. You can replay the first two pieces of this training. You can visit NCJW's Pro-Truth New York or Florida websites, do all of those things to learn about the issue. Next, you want to research your legislator's history on the issue. You can look at past press statements, social media, local news. You'll never know where your lawmaker might pop up on the bill or on the issue. Next, you want to identify why and how the issue impacts you. Why is it important to you? Perhaps you have a personal story about crisis pregnancy centers or a story from someone else you can use with their permission. Or you can look into the availability of CPCs versus legitimate health clinics in your own area. Do a Google search. What shows up? How many crisis pregnancy centers are you near versus how many legitimate health clinics? After you do your research and you think about why and how the issue is important to you, you want to assign meeting roles, and we'll get to that on the next slide. Then you want to practice using the technology, practice running through the meeting, practice making the ask. Practicing for a visit is what makes it so successful. And here's a tip. You do not need to know all the answers. Yes, it is good to research the bill and the issue. No, you don't need to be an expert. You are there as a constituent. If you are asked a question during the meeting that you can't answer, it's okay to say, I don't know, I'll get back to you. I'll look for that information, or I don't know, you'll have to find that somewhere else. Being honest as opposed to scrambling and trying to cover up that you don't know something keeps your relationship authentic and ongoing. So here are some sample roles you can use during an advocacy visit. Of course, if your group is more than 4 people, you might have more than 4 roles. If it's fewer than 4 people, you might need to play more than one role at a time. But here are just some sample roles you can go to. So someone can be the leader. That person is going to schedule and confirm the meeting time, facilitate the meeting, kind of guide it through its points, make sure the meeting stays on track. You could have a recorder, someone to take notes, and in particular, take note of commitments or follow-ups requested during the meeting so that when you do the follow-up, you're hitting all of those points. You could have an issue presenter or presenters. These are people who walk through the talking points. Why are CPCs so harmful? What would the SAD Act do, and why is it important to pass the bill? You could also have a technology lead, depending on how comfortable or uncomfortable you are using Zoom or a conference call line or Google Meet, whatever technology you use. And this is someone whose sole job is devoted to making sure the technology of the meeting goes smoothly. So once you've done all of your planning, you will actually hold the lobby visit. Here's a basic outline of how your lobby visit can go. You could start with introductions, including your name, organization, and your pronouns. If you're joined by a large group of NCJW advocates, designate just a few people to speak and introduce others by saying, I am joined by X number of NCJW advocates from your state or your district. Next, start with a thanks. There may be something you can thank the lawmaker for doing. It doesn't need to be on the topic of your lobby visit. For example, maybe the lawmaker just opened a new community center in your neighborhood that you can say thank you for. Maybe they've done great work on abortion access, you can say thank you for. If you really can't think of an issue-based, something issue-based to thank them for, at the very least, thank the people you're meeting with for their time. Next, after your introductions and the thanks, you want to talk about the issue you came to address and you want to make the ask. Consider sharing personal stories to drive home why you care about the issue, why it's so important. As you go through the meeting, you want to ask questions and listen to the answers. Hear what your lawmaker or their staff has to say about your ask. Note any follow-up questions or materials they need. It's easier to speak over another person when you're meeting virtually, so be aware of this tendency and create space for other people to speak in the meeting. At the end of the meeting, you want to say thank you, reiterate any next steps, and talk about how you plan to follow up. You can say something like, I'll send an email with the resources you requested, or I'll send an email when I get an answer to that question you asked that I didn't know the answer to. At the end of the day, your lobby visit, any lobby visit, it's a conversation with other people. So it should be no scarier than that. And like any good conversation, you want to listen as much as you talk. Here's a tip: focus the conversation on the issue at hand. The lawmaker or the staff you meet with could bring up other policy issues, or given that the week of action is in September, they could bring up the election, which they shouldn't do. And we as a 501c3 compliant organization cannot talk about, but these things happen. You want to use pivot language to bring your meeting back on track. So what's an example? Let's say during your visit, the staff person says, oh, you know what? We have a great bill coming down the pike that is about hate online. It's about combating hate on the internet. It's so great. I can't wait to talk to you about it. An appropriate use of pivot language would be, that sounds great. At NCJW, we agree it is so important to keep our online spaces free of hate and bias. Today, we're here to talk about the SAD Act, which is about crisis pregnancy centers. I'd love to find another time to come back and talk about the bill you're referencing. So something like that. Acknowledge what they want to talk about and say, not today. Today, we're going to talk about the SAD Act. Okay, so after your virtual lobby visit ends, what happens next? So first, you want to debrief with others in your visit. What went well, what didn't go well, or what you would do differently. make sure you do this on a different Zoom or platform than the one you just used. This is the equivalent of when we do this in person, not debriefing immediately outside of the office. We want to make sure that no one who is just in your visit from the staff or from the congressional side can hear your debrief. Next, you want to send a thank you email that includes any materials discussed or requested during the meeting and reiterates the ask. And submittee outline those asks as to co-sponsor the bill, or if they're already co-sponsoring, to do more, essentially. So you want to restate the ask in your follow-up email. A sample thank you email can be found in the Week of Action Planning Guide, linked here. Next, stay in touch. Advocacy truly is all about building relationships. So stay in touch with the staffer or staffers with whom you meet. And then last, let NCJW Inc. staff know how it went. You can do this by completing a lobby visit report form, which is linked in our guide. Also, this lobby visit report form lives permanently on NCJW's website. So if you go to NCJW's website and you search lobby visit report form, advocacy visit report form, you'll find it in the search results. All right, so just some best practices for virtual lobby visits, but again, really any lobby visits. So do prepare ahead of time. Be early and flexible. What do I mean by flexible? Maybe your video isn't working. Maybe the staff person's audio is in and out. We just have to stay loose and go with the flow as best we can. You want to say thank you. You want to have a meeting that starts on time and ends on time. And if it looks like it's going to run over, you want to find other time to talk. All of that is a part of time management and being respectful of people's very busy schedules. You want to stay on message, use personal stories, why you care about the issue. You want to listen as much, if not more, than you talk. You want to debrief, and very importantly, you want to stay nonpartisan. Here are some things you don't want to do. Don't introduce everybody in a large meeting. It will just suck up all of the time you have. Don't make up a response if you don't know the answer. Don't be led off topic. Use that pivot language. We agree that's important, but we're here to talk about X. Don't argue. It's very tempting to argue a point, especially when you feel like you're disagreeing on basic facts. But this can really take the whole lobby visit and just grind it to a halt. Lobby visits, as we talked about, they're conversations. They're a means to build relationships. And so arguing brings those things to a stop. Sometimes you can literally say, it looks like we're just going to have to agree to disagree on this point. I've used that language before in a visit. Don't talk about the election. Yes, it's coming up. No, we can't talk about it. And last, don't be intimidated. As a constituent, you have every right to be there. You may be an expert on crisis pregnancy centers and the SAD Act. You might have learned about it a few days ago when you did your research. Either way, you're a constituent, your voice matters. You have every right to be there. And last, have fun. Well, I find lobbying very fun. It's part of why I do what I do, but it's a conversation. You're building relationships and you're talking about issues you care about. And I think any day where you feel like I tried to move the needle on something I care about, that can be a good day. All right, so some next steps now that we've talked about the issue of crisis pregnancy centers and what the SAD Act would do. And as I say that, I want to give a really warm and big thank you again to Aviva and to Simriti for sharing their knowledge and expertise. What do we do next? So if you're a member of an NCJW section, reach out to your SPA, State Policy Advocate, or section leadership to see if there's a visit that has already been set up that you can join. If there's not, you can offer to help set one up. If you're not a member of an NCJW section, or if you are and you want to do more, you can set up your own lobby visits with your elected officials. And then the last piece, I'll just reiterate something I've said a few times. So information about lobbying on the SAD Act and the Week of Action broadly, again, that's September 12th through the 16th, with in particular the lobby day, the highlighting of the lobby day will be that Wednesday of that week. So all of that information can be found in the Week of Action guide, which can be found at this website. So with that, thank you all for your time. Have so much fun lobbying. Thank you again to Aviva and Simriti, and good luck.